everyone, Dr. Madeline here from Forward Spine Center. And do you clench your teeth? Maybe you wake up with jaw tension, or your dentist has mentioned to you that you wear your teeth. Well, this video is for you. Today I'm going to demonstrate a chiropractic adjustment and soft tissue work for a patient that clenches. She has a history of repetitive computer use, headaches, and that jaw pain. So let's show how chiropractic care can help. Do you have a headache today?
Really small one.
Where is it at?
Where I usually have it, like the back of my head.
The temple.
The base, yep.
Does it ever travel up into your eyes?
Mm-hmm.
Forehead? Temples? Yeah, you get a lot of tension along your cervical thoracic junction, right there. First rib on the right. You work on a computer.
Mm-hmm.
Yeah, so watch that posture. Make sure that shoulder isn't leaning forward too much. Get that shoulder blade back. Do some work on the jaw. History of right TMJ tension. Ringing in that right ear. Okay, open up. Good, and then close. So here I'm going to kind of work on the masseter, but I also like to do a little fascial lengthening up into the ear. A lot of times when you get that TMJ tension, you can also get that ringing in the ear and how much that tension can pull on the surrounding areas. It's releasing really well. Do you wear a mouth guard at night? Has a dentist ever stated if you grind your teeth or have wearing?
Not a dentist, but a sleep study doctor.
Okay. Space along that TMJ. You feel that stretch? That fascial tightness from the shoulder can travel all the way up into that area. We're going to get one more spot. Open up. We're going to get the pterygoid. A lot of times this if this area is really tight, it can also create more of that headache, that zing right up to the eye. So when we release this area, this nerve irritation, it can sometimes release that nerve headache-like symptoms up into the eye. Big focuses for TMJ is also focusing on posture. What I say is always stacking your blocks. Stack your head on top of your shoulders on top of your hips. Trying to keep that chin retracted, chin down. There you go. When that chin juts forward, it causes that jaw to lock, to become more stuck, more tense. So when our posture is more upright, it creates more of an opening in this jaw. How's that feel? Good? Is that a good?
Yeah.
Good. Thanks for tuning in. Dr. Madeline, thank you for allowing me to be part of your health journey.